The Reclaim Party MP Andrew Bridgen was finally granted a debate in the House of Commons on worryingly high excess deaths in this country in the aftermath of the pandemic. Here's what he told the House yesterday.
We experienced more excess deaths since July 2021 than the whole of 2020. Unlike the pandemic, however, these deaths are not disproportionately of the old. In other words, the excessive deaths are striking down people in the prime of life. But no one seems to care. I fear history will not judge this House kindly. Worse still, in a country supposedly committed to free and frank exchange of views, it appears that no one cares that no one cares. Well, I care, Mr. Deputy Speaker, and I credit those members here in attendance today who also care.
So why are excess deaths so high, and why is no one talking about it, least of all MPs? The chamber was all but empty yesterday, with only the likes of GB News presenter Philip Davies in attendance. To debate this, I'm delighted to welcome Andrew Bridgen himself, as well as renowned NHS GP David Lloyd, Dr. David Lloyd, I should add. Now, Andrew, first of all, for the uninitiated, what does the expression excess deaths actually mean?
Well, please, to define excess deaths, what you've got to do is estimate the number of deaths that were expected, and if you've got more than that, you've got an excess. There are various ways of measuring it, and the ONS, unfortunately, are using a method where they count in their baseline for their average the year of 2021. Obviously, there was nothing average about the deaths in 2021, and obviously, the higher you make your expected number, the less the excess. So there are different ways of calculating it, but every way you calculate it, there is an excess. And what I've identified is, with the help of scientists who've posed the questions, is that the ONS aren't actually reporting the correct weekly death figures, because a large number of deaths are actually being reported to coroners for investigation, quite rightly, but then those figures are never being incorporated into the weekly death figures, possibly not for years.
What are some of the damning headline figures? Because I think there's concern about the number of excess deaths and also the age groups.
Well, it's ischemic heart disease and heart failure are the big excess death reasons, excess mortality reasons, not only in the UK, but around the world, because this isn't just a UK problem. It's stretching across the developed world all the way around to Australia, who've got some shocking excess mortality figures, exactly the same as we have. But Australia is a very interesting for the debate, because they actually rolled out the vaccines, the experimental vaccines, before they got many cases of COVID in large amounts of their country. And what they actually saw was excess deaths that were nothing to do with COVID at all, because they hadn't had any cases of COVID in parts of Australia, but they had the vaccination and they suffered the excess deaths.
Dr. David Lloyd, good to have you on the programme. Why do you think excess deaths are so high? Are you concerned?
Yes, I think I'm very concerned. And to answer Mr. Bridgen's very detailed research, I can't do that. But I think there is an issue about causality. We know that people who died in 2021 and 2022, 93% of them had a COVID vaccine, and there was a huge increase in mortality. But it wasn't caused by the COVID vaccine. As Mr. Bridgen has just said, there is this very strong link between COVID, the disease, and the development of heart disease later on. I think we're in the middle of a very long tail. I work as one of my jobs, I work as a medical examiner at my local hospital, where we look into the deaths of people who die in the hospital. And people are dying of COVID now. People are dying in intensive care of COVID, but they won't be counted as a COVID death because they died beyond the 28-day rule for with a test within 28 days for COVID. So underreporting is a big issue. We are going to see an awful lot more deaths, and we're going to see an awful lot of people who have had COVID who develop heart problems later on in their lives as well. So it is a very worrying problem. But the important thing to say is that it's not the vaccine that's causing this problem, it's the disease. And the vaccine is the cause, is the thing that we need to give people still to stop them getting the consequences of COVID and the heart problems associated with that.
Andrew, do you accept that point, that actually it's COVID which is causing these heart problems rather than the vaccination?
Well, it couldn't have caused it in Australia, where they were vaccinated before. They didn't get hit hard with COVID until the Omicron wave, which was much later, and they had already got the huge increase in a 67% increase in reported hospitalisations for cardiac arrest in southern Australia. I quoted all those figures in my speech yesterday. And also, the learned doctor should know, there was a very, very good paper from Israel that came out, established, I think, about 12 months ago, which clearly showed that COVID itself did not cause increases in heart failure. This is totally down to the vaccines. We know that the vaccines cause myocarditis and pericarditis. That's now been admitted. In the Pfizer trial, there were 4 patients in the Pfizer trial group who died of cardiac arrest, but only 1 in the placebo group. I think that is pretty significant now. That's pretty significant.
Dr. Taylor, we heard so much about the COVID death toll during the pandemic. Why the silence from the medical establishment over excess deaths? I take on board that you're concerned, but I haven't seen too many medics on TV publicising these excess deaths.
Oh, I think it's a very common thing to talk about amongst doctors. It's a very common thing to talk about. I mean, don't forget...
Well, I haven't seen any press conferences. I haven't seen any newspaper headlines about it. Well, and I've also not seen any television networks debate it. And the House of Commons was empty yesterday. Why?
Well, I think that the extreme views that people have about that, you call it an experimental vaccine, is not an experimental vaccine. It was developed using all the proper...
Well, why is it under emergency use authorisation? Why is it still under emergency use authorisation with product indemnity?
Tell me why the Nobel Prize Committee decided to award this year's Medicine Prize to the 2 people who developed the mRNA vaccine. We know this vaccine is a major, major advance.
They also gave...
Wait, Andrew, I'll come back to you. Let Richard finish his point. Richard?
I'm just saying that the COVID vaccine is...
David, sorry.
The first... Sorry, I didn't answer to your name. The COVID vaccine is the first vaccine of a bunch of mRNA vaccines that are going to come in, which are going to be of fantastic benefit to the human race. We're now investigating whether mRNA vaccines can treat cancer, and there's a strong possibility that they will. So when people start to doubt the science, when people start to call it an experimental vaccine, that is detrimental to the development of medicine. The Nobel Prize Committee don't just award these things because on a whim. They do very detailed research. And so it's a fantastic boost for mRNA vaccines that we've got the Nobel Prize. And the data shows that only 51 people in the entire country died as a result of COVID vaccinations, which is one chance in 359,000. Whereas you contrast that to the hundreds of thousands of people that we saved from dying from the vaccine, the evidence is overwhelming that this vaccine works and is safe and should continue to be used. And we are still seeing people dying of COVID. So I think Mr. Bridgen is a very good, he's done lots of in-depth research. I commend him for getting this relatively difficult to obtain data. But the mainstream medical profession strongly believe that the benefits of COVID vaccines far outweigh the risks when we're dealing with such a deadly disease.
David, I'm just going to be a final question to you before I come back to Andrew. I've got no doubt that the vaccine must have been very helpful for those who risked hospitalisation or serious illness. But given that the vaccine neither stopped transmission or prevented you from getting COVID, why did we vaccinate healthy people at low risk, particularly children?
Well, I think you've hit on a very interesting point, and I'm afraid I'm not an epidemiologist. And as you say, although there is some weak data suggests that it does prevent transmission a little bit, it's not actually designed for that. As you say, it's designed to prevent hospitalization and death. So, yes, I think that there needs to be some big talks about who should get it. And as you know, this round of vaccination we're doing at the moment is only for the at-risk population. It's not for children.
Andrew, an empty House of Commons yesterday. Why?
Well, I'd just like to come back on the point about the Nobel Prize Committee. There's a lot of politics and money involved in the Nobel Prizes, and I would remind your viewers that they did give a Nobel Prize for medicine to the man who invented frontal lobotomy. I'm not sure that the learned doctor would want to stick that. That was a very well-deserved accolade. There was no in the chamber.
I can talk to you a lot about that. Not now.
There's nobody in the chamber because they didn't want to talk about it, and unofficially, that's what they don't want to talk about. When I raise issues that they don't want to talk about, the reason I'm shunned in Parliament is because the public do want to talk about these issues. They want to talk about excess deaths. They want to talk about vaccine harms. They want to talk about the sexualisation of our children in schools through PHE education. They want to talk about the WHO power grab over our sovereignty. And when I raise these issues, constituents email their own MP because they're concerned about it, and it forces MPs to debate and put themselves certainly on the wrong side of history. But the sort of trouble is that history is written by the establishment and the victors, and we haven't won yet, but we are going to, because the truth will come out.
My thanks to...
The truth is already there for COVID vaccination.
OK, my thanks to NHS GP, Dr. David Lloyd. Thank you, David, for joining us. And Andrew, thank you for your time as well. Andrew Bridgen, MP. Brilliant stuff and a fascinating debate. Your verdict, please, mark at gbnews.com. Should we talk about these excess deaths and what are your concerns about them?